Dengue cases are steeply on the rise and dengue deaths escalating. Are the government establishments, more so the health department and the private hospitals, being open about the number of dengue deaths and the number of dengue cases that are prevalent in Tamil Nadu? Let's discuss about this with Dr. Nakamatsu Kumar, consultant physician, and Dr. P.S. Chandrasekhar, consultant pediatrician and neonatologist of the Royal Care Super Speciality Hospital. Thank you so much for talking to Covai Post, Doctor, and I think we're going to discuss on a very important topic today, something that's been creating a hell of a lot of panic in our state, the dengue death and the steeping dengue cases. Now, my first question to Dr. Nachimuthu would be, Doctor, we are seeing an intensified dengue this year, and dengue has always been there. Why do you think dengue is so severe this year, and are you witnessing a different kind of a strain? We know that it's a vector-borne disease, so yes. Yeah. So, is there a different kind of a strain that is increasing its severity this year?
So, coming directly to your question, see, dengue happens every year. Even government has statistics for that. It happens. The epidemic starts from end of May. That is, it coincides with the onset of monsoon, and it goes on till November, December, till the climate is when the winter sets in.
Yeah.
So thing is this epidemic severe? So does only Tamil Nadu experience this? No, it is not just Tamil Nadu. It is in Kerala. It is not just confined to South India. It is even seen in North India, and it is even more rampant. Because I can say that because I was working in a tertiary care hospital in Chandigarh.
Okay.
So that is India's number 2 hospital. It's called PGH Chandigarh, and it is the tertiary care hospital for 4 states in North India: Jammu Kashmir, Punjab, Haryana, Himachal Pradesh, and the Union Territory of Chandigarh.
Okay.
So we used to have all the referrals from tertiary care hospital, primary and secondary care hospitals from Haryana, Punjab, Himachal, and even Uttar Pradesh, Saharanpur area. And we always used to open a special ward for that. We used to makeshift wards. So we used to change that attendance waiting room into patient's ward, and we used to bring.
So you're saying there also?
Yeah, it's there. It's quite rampant there.
Okay.
It's quite rampant.
The number of cases are very high.
It's very
How about
high.
deaths, Doctor?
Deaths, actually, I don't have the exact statistics, because the problem with
but you will be able to gauge. Tell me, is it as severe as what it is now in Tamil Nadu?
Deaths happen, but I can't give you the exact, because I'm not a statistician and I don't have the statistics.
That is a problem, don't you think, Doctor? I think the problem in medicine itself, something that India, it's a major drawback, is that we don't have proper data and statistics for anything.
Indeed, we have statistics, we have statisticians, and it is submitted to the government, and statistics is maintained. But thing is, sometimes when a patient comes with dengue. No, it's not dengue. Even I'm wrong here. Patient comes with fever.
High fever, right?
Yes, he comes with high fever, and nobody knows what is that fever, and everything is attributed to dengue. Like a patient.
No, obviously it becomes positive only after you test it.
No, that is a problem. See, what happens is, in small hospitals and small centers, and I can't blame them, in primary care centers and all those places, you can't afford to buy a ELISA machine. That investment costs lakhs. And what they do is they just do a card test. It has got a rapid on-the-spot diagnostic, rapid RDT kits. So thing is, the false positivity with this thing is quite high. So even the government has notified through orders and all those things, and the World Health Organization, it is intimated that you're not supposed to diagnose dengue with a rapid card test. So thing is, when it comes to diagnosis of dengue, so when a patient comes to me, he comes with a history of fever for 2 or 3 days, and what I do is just I'll go for a platelet count and a WBC count. So what is usually seen in dengue is low WBC and low platelets, that usually seen in 3rd or 4th day. But the problem is, it is not just confined to dengue. It could be enteric fever.
Right.
It could be scrub typhus. Scrub typhus is something which I have not heard of, but it is still common in Tamil Nadu. Especially it is seen among the border districts of Tamil Nadu with Andhra Pradesh.
Okay.
And CMC Vellore, they have reported the highest number of one of the highest number of case study has been done by CMC Vellore. So, but we are not aware of that. So a patient comes to me and he has this platelet count, low platelet count. Low platelet count can happen with any viral illness. Could be dengue, it could be H1N1.
Okay.
It could be H1N1 or could be any other virus.
Doc, hold your thoughts there. So, doctor, you tell me the maximum number of cases. Are children really vulnerable? As a pediatrician, are children really vulnerable to dengue? We are seeing a lot of dengue deaths also, among children.
I won't say children are vulnerable to dengue. They are as vulnerable as other people. But when the serious problems, when they arise out of dengue, like dengue hemorrhagic shock or dengue hemorrhagic syndrome or shock syndrome, when children develop those complications, they suffer more because they have got less reserves in their body. So getting dengue, they get as like adults. I don't say they are more vulnerable.
Okay.
So I don't want to say that they'll get more dengue.
Okay.
But when they develop complications, the chances of getting severe outcome is quite possible in children because they are young.
Okay. Doctor, I want both of you to speak a little bit on this very briefly, but tell me, are the number of dengue death cases and the number of the incidence of dengue cases itself, are they very understated? And why is it that, despite, it's very visible that there are a lot of deaths and a lot of cases, why is it so understated this time?
I don't say there are more dengue cases now. I think they are more reported now because the hype created by both print and visual media, it's been spread that acid is coming.
We are creating awareness, doctor. Okay, go ahead.
Very small difference. My fine line between them. I agree.
Okay.
Awareness is good, but what I'm saying is dengue is with us for the last 1,000 years.
Right.
It's not a new disease. As a doctor and medical student,
but we didn't have so many deaths. So are you trying to say that there were so many deaths? It was because of dengue, but it was not out? Is that what you're trying to say?
Yeah, exactly, because we do not know whether they died of dengue or not. They might have been died of dengue or some other difference. Now we make more diagnosis of dengue. Those days, 10-15 years back, we have no facility to diagnose dengue.
Okay.
So now we are making diagnosis of dengue. So that means it appears to you that, oh, now there are more dengue.
Okay.
So some people even think that dengue is a new disease. This came in recent years. No, it's not. Wherever there is a mosquito and wherever there is a man, there is a chance of dengue is there. This is there for the last 1,000 years.
Doctor, you agree on this? I mean that it's only because now it is reported more, which means of all the fever-related cases that have been coming in, it could either be dengue or swine flu, but we didn't know so far. So it's only because of that.
Yes, the reporting system is very strong now. We are able to get the data nowadays. Before 15 years, no one was able to collect the data and no one was able to make the diagnosis also. So now I can do it right now. For 15 years, we didn't have the diagnostic kits, diagnostic methods and all those strong infrastructure for diagnosing dengue. So, and now print media and electronic media and people, news is disseminated fast and people know things fast.
So you're trying to say that probably even last year we would have perhaps had this many dengue cases and this many deaths, but then you didn't have the technology that we have perhaps this year. You couldn't diagnose. I mean, it's hard to buy that argument, doctor.
Even last year we had a lot of dengue deaths.
Not as many as this year.
But we need hard data to compare that.
That is why I'm asking you. But then you didn't agree on that with my earlier question that we lack statistics. We don't have statistics. And the other question which is related to this, tell me, doctor, are you supposed to intimate the health department on the dengue cases and the dengue death?
Yes, of course. Yes,
even the private hospitals are supposed to. But why are we not then getting a consolidated figure when all of us know that it's the figures are very understated? Is it because the government really doesn't want to come up with the figures for the fear of triggering panic?
How can you say that it is understated? Because
it is understated. It is understated. How are you saying that it is not understated and the figures are right?
Unless we have hard data, then we can say it's understated.
Okay, doctor, you want to add something?
Actually, we are reporting it to the government. The government gets and collate all the information,
Right.
and the government releases it. So, how do we prove that the government is not releasing the correct data?
Okay.
Or how do we disprove that the government is not releasing correct data? If that is done, it will be very useful. I would leave that to you.
Okay. And also, I'm also asking this because this is a recent incident. There were 2 dengue death cases. One, both from private hospitals here, KMCH and GKNM. But the certificates showed that the cause of death is dengue. But when we approach the private hospitals, for their take on it, they were mum. So, I mean, do you think that there is a gag on the private hospitals to not disclose the number of dengue deaths or the number of dengue cases by the government?
No, definitely not.
Okay.
No gag orders has been issued, and
are you talking only about yourself, or you're talking generally for the private hospitals, doctor?
I can't talk on the behalf of all private hospitals.
Okay.
But as far as I'm
As far as we are concerned, we don't have any gag orders.
Okay.
and also my interactions with my colleagues, nobody has mentioned about that any
Okay.
gag order or something, because usually it comes out during a quiet chat. They say there is some gag order or something. It's not so far.
Yeah.
But we don't know whether everybody is quiet, keeping quiet.
But off the records, doctors do say that the number of cases are on a rise, or the number of deaths are more, but then they don't much go on record. You think so?
So far, no idea about that.
Okay. Doctor, you tell me, what do you have to say about Nilavembu? I'm asking you this question because I heard a couple of allopathic doctors saying that Nilavembu is a hoax. But everywhere, the government, the civic body, everybody are supplying Nilavembu to the patients as a preventive measure, going by the rise in dengue cases. Do you think that this is the usual, allopathic and Siddha, medicine difference of opinion? Usually doctors have that because Nilavembu is construed to be a Siddha medicine, so Siddha product rather. So do you think it is that, or does Nilavembu really work?
To start with, no doctor has any grudge against other system of medicine.
Okay.
Medicine is art of healing. Whatever be the method, if the patient needs to be benefited, so whatever it is, we accept it very easily. There's no problem with that. But even the exhaustive guidelines prescribed by the World Health Organization for dengue fever, it did not have any mention about Nilavembu.
Okay.
It did not have any mention.
So you differ.
It did not have any mention about Nilavembu for prevention as well as curative treatment. I'm asking you, is it for prevention or curative?
It is. I think it is for prevention.
Then why do you give it for people with fever then, when they develop fever?
Probably it's curative. You tell me. You're the doctor.
No, I said.
So you're saying that Nilavembu is not going to work, be it prevention or curative.
See, the same questions. Not only you, many of the parents are asking me. I tell them.
Okay.
It doesn't do any harm. That's it.
It doesn't do any harm, so it doesn't do good either.
I didn't say that.
Come on, doctor. Tell me.
See, that's what I'm saying. It doesn't do any harm, but we need many hard evidence that. And
they also say, doctor, maybe you could take this question. The papaya leaves, does good. I mean, so what is allopathy saying? Is none of the what our forefathers believed in yesteryears, nothing of that works. It's only tablet all the time.
Allopathy believes in, I won't even say it's allopathy. It's modern medicine. Modern medicine believes in evidence-based data. We believe in hard evidence.
Okay.
So we are going to treat someone, we need evidence that it does good. So for that we need studies.
Okay.
So our medicine system is based on studies done before. So just can't follow because just our forefathers say this and that. So we need evidence. That's all.
Okay.
This is not only for Nilavembu, even for other things as the same logic applies. See, our forefathers haven't got the ability to do the research. But now it is freely available. Why can't we
But then
do
they
research
did
first and
cure
then
they
take it
did
out?
cure a lot of ailments even then with whatever resources were available.
Who said
Yeah, it was.
Yes,
but
doctor.
Why can't we do it now, research?
so? Documented evidences. See, in this era, documented evidences, hard evidences, only that.
We need evidence. We need research and evidence.
We need evidence. Because just because someone said, like, they did that, we flew an aeroplane before 1,000 years. It is not true, actually.
No, nobody said we flew an aeroplane before 1,000 years.
People say that, no?
Different words.
Okay. So I think, Doctor, for time constraints, we'll finish it with that, but we will have another discussion shortly. There seems to be a lot of differences, there seems to be a lot of disagreements, but the fact, I think, is that dengue is on the rise and the number of deaths are also on the rise, but we don't seem to be getting proper figures on that. Thank you so much for talking to Kobe Post.
Thank you.
Thank you.